This is Tom Necky, and today I'm talking about a topic that a lot of people ask me about, and it's, do you have numbness, burning, tingling at the bottom of the foot? This is a disorder people hear about in the wrists all the time called carpal tunnel, but in the ankle, there's something called tarsal tunnel. So see this nerve on the inside right here, it runs all the way down. And as I take off all this foot muscle right here, you can see that it radiates up into the toes. So if the bottom of your toes are numb, burning, tingling, if you're standing and they're aching, they're throbbing, if you're laying down on the couch at the end of the night and they hurt, they ache, and in bed, if they're doing the same thing, if you have burning and tingling at nighttime, this could be tarsal tunnel. So it's this nerve on the inside of your ankle causing these problems. So this is something I see all the time, and it's actually a lot easier to take care of than you think. And that's what we're going over in this video, and we're starting right now. So normally I do a little bit of a joke at the beginning, but this is a pretty serious topic. I know people are very, very debilitated with tarsal tunnel, and really think about it like this. If your foot flattens out, then you will stretch that nerve on the inside of the ankle. So I always show people, watch this. If this is your foot and it collapses like that, or on the back, I like to show it like this. If your foot collapses and see how the inside of the arch stretches there, that's going to stretch that nerve. So that nerve stretches, it stretches this way, and that stretching eventually causes a nerve injury. It's like your arm falling asleep. So if you sleep on your arm like this, that can be nerve compression. If you have something squeezing your ankle, that could compress it too. But simply your ankle collapsing can stretch that nerve. So I see this very, very commonly. It's associated with flat foot. It's associated with people standing all day, and it's such a common problem, and it doesn't need to be. But first, one thing I say is, if you have numbness in other places of the foot, I have links down below. So in the front of the foot right here, you could have a Morton's neuroma. On the bottom of your heel, right here, so if it's on the bottom of your heel, that could be Baxter's nerve compression. If it's on the inside of your ankle, it could be posterior tibial tendonitis. It could also be tarsal tunnel. And if it's on the outside of your ankle, so see on the outside, if it's there, it could be peroneal tendonitis and the associated nerve injuries there. I link those below. I'm not going to talk about them here, but if you have numbness, burning, and tingling in other parts of your foot, down below, we take care of you with the links. So what are the causes of tarsal tunnel? The number one cause is flat feet. So I kind of showed you, as they collapse, that nerve stretches. On the inside of your ankle, see my foot model's already fallen apart because I took everything off. You have a tendon here called your posterior tibial tendon. If that's inflamed, that's going to irritate the nerve as well. So that's possible. It's possible on the inside of your ankle to have varicose veins. It's possible to have lipomas. A lipoma is a tumor of fat. It's possible to have bone spurs. There is a study that shows 2 in 5 people with tarsal tunnel have flat foot, it's some type of ankle sprain, some type of ankle injury. We have all these linked below. We go over ankle sprains in depth. We go over our flat foot guides. We go over our best shoes, our best orthotics, everything. We're gonna go over it in a little bit here, but all that's linked below. This is stuff you generally have to control, but we're gonna go over specifics later. It's also possible to have this associated with diabetes, with rheumatoid arthritis, with being overweight, with having systemic problems. So there's a disease called peripheral neuropathy, which are nerve diseases. It's possible to have that too. It's less likely. In my opinion, the vast majority of the time, it's very, very correctable, and we're gonna go over how to correct that in this video. And we already talked about symptoms: weak muscles, collapsing foot, numbness, burning, tingling at night. You never get relief. So here's how you wanna test it. What I usually do at the beginning is I squeeze with my fingers for like 20, 30 seconds. And if on the inside of your ankle, there's a sore spot where your foot starts getting sore and numb and achy and it radiates up and down, that's called the Tinel's test. So does this guarantee that you have tarsal tunnel if you have pain there? It doesn't guarantee it. Some people might not have any pain, but if it's sore there, it could be tarsal tunnel, and that's called the Tinel's test. Here's how you diagnose this. The reality is, the most common thing we see is misdiagnosed disorders. Even though this video is meant to help, the disclaimer is always go see your doctor. And hey, I'm a podiatrist. We love to help with these things. So what we would do is we would assess what's going on. Do you have any of these risk factors? Can we get an x-ray? So with an x-ray, is there bone spurs? Is there a broken ankle? Is there some type of flat foot developing? If that doesn't work, we could get an ultrasound. So I'd love to do an ultrasound in the office and we could see, is there varicose veins? Is there a fatty tumor? Is there swelling around the nerve? Is the nerve really achy and throbbing when we press on it with ultrasound? If that doesn't show anything, an MRI might help as well. If that doesn't show anything, I do work with a team of neurologists. So at our clinic, we're very benefited. We have internal medicine doctors, we have nerve specialists. And what can happen is we can do tests like EMG, nerve conduction studies to see if there's some type of compression where the signal's not running down the nerve. So that can be really important if these basic home remedies don't work. But the vast majority of the time, I have success with these, and very rarely do we need to order these tests. But nothing's a guarantee. There's a lot of people watching these videos, and that's always the disclaimer. Go see your doctor. Nerve surgery. Does tarsal tunnel surgery work? I see wrist surgeons almost every day. They're lining up like 10 surgeries. It takes like 5 minutes to do this, and it's a very easy surgery. It's a little bit different for the foot. So in my opinion, with the wrist, because you're sitting on the computer, you can loosen some ligaments and there's less pressure on the nerve. The problem with the foot is this, and studies actually do show this. As the foot collapses, the nerve stretches. Loosening the ligaments and tendons around that, it's not that it's getting squeezed, it's that your foot's collapsing. Listen, if you're 400 pounds, does it sound like loosening the ligaments will actually get pressure off your foot? It won't. It will make you even more unstable. So studies actually show loosening these ligaments could make things worse. So that's why I don't do very much surgery anymore with tarsal tunnel. The reality is, the methods I'm going to talk about, I think personally I have 95+% success. I would say it's even higher than that, but I know people are going to attack me in the comments because, hey, this is not published research by me, but it's from seeing hundreds and hundreds and hundreds, if not thousands and thousands of these patients. You know, I am very, very confident that we can get, at the very least, significant relief unless there's some type of tumor, unless there's some kind of nerve disease, unless there's some type of bone spur from a prior broken ankle. But even then, you should still have a lot of relief. So number one, I love ankle braces. So ankle braces stop the foot from buckling out. And if it doesn't buckle out, it stays straighter and the nerve, there's no tension. And the thing is, all these methods, you need at least 1, 2, or 3 months to get better. You could do all the perfect stuff for 2 weeks that I'm going to talk about, and if you don't have relief, that doesn't mean anything's wrong. You just need more time the vast majority of the time. With these nerve injuries, it's kind of like if somebody punched you. You need like a week or 2 to heal. You don't need like just 1 day of somebody stop punching you. You know, if somebody punches you, that bruise takes a while to go away. Think about the nerve as a bruise. And if you do all this perfect stuff that I'm going to talk about right here, it still will take some time. So stick with it. Don't give up right away, because a lot of the times it does take weeks or a month or 2 at the very least to get a lot of this pain to go away. But ankle braces are amazing. So there's soft braces and there's supportive braces. I, in this case, love the supportive braces with the ankle brace tightened on the inside to hold your foot straighter. That's the way to go. So support, take a look at this. Without support, look at how much that ankle collapses. That stretches that nerve. Collapse on the AP plane, collapse in the front, and collapse in the back right here. Look at that nerve stretching right there. How do you stop this? It's so easy. An ankle brace could do it, as we mentioned, or number 2, take a look at this. No more collapse, no more collapse, and no more collapse. Ankle support through an orthotic and a brace, amazing. That does such a great job already. Our favorite braces are down below. Our favorite orthotics are down below. You don't need crazy expensive stuff. We're talking like $20 each. And you know what? If you have this problem and you don't try this, you're doing yourself a disservice for sure, because a brace plus an orthotic, the vast majority of my patients, significant improvement. Just doing that alone, if you diagnosed it correctly, that's the big if. Braces, orthotics, that really does the trick. And then if you have those two things, a great pair of shoes. In this situation, I'm going to show why I would have tarsal tunnel on my left foot, but not my right foot. So pretend this is you. Your right foot might bend up, but your left foot's not as flexible. And when you stretch, you can tell. So it's got to rotate out. So when I land on the ground with my left foot, it has to rotate out in this example. Because my right foot's more flexible through my calf, through my hamstring, but the left foot's tighter, it's stiffer. You know if this is you, and you can feel it, like one leg absorbs more, so it's got to turn out. So take a look at this healthy young gentleman. He's not going to have any tarsal tunnel pain, most likely unless he has a tumor or something, because his feet are not really buckling out. The inside of the ankle is where those thick nerves are going down to the bottom of your foot. Whereas check out this person. Look at how much they're buckling in on the inside of their ankles. Each one of those steps zaps, jolts, and stretches the posterior tibial nerve. That over months, years, can lead to severe stress on that nerve that will cause numbness, burning, and tingling. And this older person specifically, he's stiff, he's tight. There's sharp jolts and snaps through the ankle because the calf, the hamstring, there's not enough flexibility. You could see that foot is flattening out, it's not supportive. The biggest opportunity I see is barefoot walking. So again, look at this collapse right here. When you're walking barefoot, your foot collapses, but look at this. Even a good supportive pair of sandals right here. Look at no collapse. This is a cheap pair of sandals with some basic arch support that I got for like $20. That will do the trick. Now imagine if you're doing great shoes like Brooks, Hoka's, Asics, New Balance, On, Mizuno's great, Saucony's great. There's so many great shoes out there that are so supportive. Down in the show notes is our favorite shoes. These really make a big difference. So make sure you get your lace-up ankle brace, your orthotics, your shoes, ease into them. And the big thing is home slippers. So sandals right now have great orthotic support, and slippers for home too. If you're in a cold area like Michigan, like me, make sure you get some slippers because that makes a huge difference. As far as slippers goes, I'm a big fan of Vionic slippers for women. So see, for these types, you have pretty nice built-in arches. They're not really expensive. They're like in the $40, $30 range. But you can see the arch is pretty aggressive in most of these. You can't really go wrong with a brand like Vionic. So Vionic is excellent. Vionic caters more towards ladies, I would say. Even though they do have some shoes, I would recommend don't use them for shoes, but kind of like a house slipper to walk around the house. They are fantastic. There are better shoes you can get though. For men, I would recommend something like a Spenco. So see, they're just a little bit more earth tones. I kind of have this one up here in the corner. That works really well. So these can work really well. See, they make slippers, sandals. My wife uses these. She loves the Siesta Slide. So these are really good as well. So Spenco and Vionic are great. For shoes inside the house, if I had to pick just one, go with the Brooks Ghost that's down in the show notes. So you could see last year's model is a little bit cheaper at about $109. The new model, the 14, is like $140. These are phenomenal shoes. If you can get an insole from your podiatrist, an over-the-counter insole, and again, down in the show notes are my favorite, get a good Brooks Ghost. Get the insoles we recommend down in the show notes. It's going to really make a big difference for you. Stretching and exercising, that makes a good difference as well. So I use these videos a lot because they apply a lot, but an ice can, an ice bottle. So I froze this can right here. I rotate it through the inside of my arch. I can roll it on the back of my calf, but this frozen ball is a cool little trick too. It's like a $30 device, not great for the bottom of the foot, but great on the calf, great on the hamstring. You can use these rubber balls to massage the bottom of your foot. You can use all your body weight to do that. That can be very effective. And then there's harder ones, don't injure yourself, but loosen up that plantar fascia. And this is my favorite tool for massage. This massage stick right here, you can use on the calf muscles. And especially when you get up in the morning, when you're tight, you're stiff, all your muscles at the end of work, when you're tight and stiff and filled with lactic acid and fluid in your muscles, and they're just not flexible, get the bottom of your feet, get the back of your ankle, get your calf muscles. Use a towel then. I recommend massaging and warming up before stretching. So see, I could barely touch my toes if I finished a long day of work or woke up in the morning. But if I massage ahead of time and massage roll, that lets me get better gains with my stretching. There's some people stretching all the time and not making any gains. The trick is to loosen up those muscles through massage, then lock in that stretching. So there's creams. BioFreeze is my favorite. It's safe, it's low cost. So here's somebody applying creams, and it's meant to signify anti-inflammatory creams like Voltaren, like BioFreeze. But pills can help in the short term. If you're in severe pain, anti-inflammatories like Aleve or ibuprofen can be helpful. Try and avoid acetaminophen because that won't help inflammation. But don't do this more than a week or two, and always check with your doctor. Pills can be dangerous for everybody, and I've seen a lot of people blow out their kidneys. Bob and Brad are great dudes. They sent me this gun in the past. I use it a lot. I use it every morning personally if I ever get tight through my hips, my glutes, my hamstrings. This is not meant to be used on your tarsal tunnel. Don't use this on your tarsal tunnel. The real trick is to use this on your calf muscles, your Achilles tendon, your hamstrings, your thigh muscles, your butt muscles, your glutes, your lower back. Don't hit like really sensitive nerve or bone areas, but get the middle of those big, thick, swollen muscles and use that rubber ball there. See, don't use that like that prong. That's ridiculous. Like that's going to just bruise you up. Same with like that bullet. Get that rubber ball. Don't injure yourself. Don't cause yourself more pain. But this can be very, very effective. It's a lot cheaper. There's some cheaper ones like 30, 40 bucks I've seen. Go with those ones if it's better for you. Take a look at these biomechanics. The knee angles are different. The hip angles are different. And I learned from a great biomechanics institute once, it's almost never the bone. It's almost never the joints. It's always tight, stiff, sore, and injured muscles that have not recovered properly. This is what leads to all kinds of stuff like this. This is what leads to uneven loading of your knees, of your hips. It's tight, sore, overworked muscles. And take a look at the top right here. Look at that ankle buckling in. That's called overpronation. That's stretching that tarsal tunnel and beating it up with every single step. If you keep walking and stretching it out, you're never going to get better. So if I haven't hammered it in already, massage and warm up first. So that will help get rid of the pain. So just a couple ankle rolls in the morning, massage, get those muscles loose. I love the massage sticks, the icing ahead of time, but then stretching. So before I massaged, I can't touch my toes, but after I do, I can easily do it. And then I stretch, and I'm talking like 30 seconds per muscle for your hamstring, for your calf muscle, but make it a routine. The trick has to be a routine. There's a ton of stretching videos out there. Just do it every single day. Is something like this pretty good? Yeah, absolutely. But in the videos, I kind of use a towel to do the same thing. You can do a lot of different stretches. You can sit in a chair. If you're really having a hard time getting down to your feet, this is not bad. It holds your foot. It helps you get a nice calf stretch and I'd use it specifically for these, although the thigh is good too. But use a towel to do the same thing. That's kind of my thoughts there. These stretch splints are pretty popular, and the idea is you put your foot into it overnight. So see, and you can adjust these straps, see these angled straps, and tighten them, and that hinge along the heel tightens. This can hold you in a stretched position for a long time. These are called night splints because people wear them at night, but look at 90% of patients I know it's very uncomfortable to wear while sleeping. I would put this on while you're watching TV if you do use this to do some stretching, and it does work good. Number one, you could stretch yourself, but if you want the more automated route, put your foot in this, tighten it, and do it for like 10-15 minutes while you're watching TV. If it's more than like 15 minutes, your ankle and your Achilles tendon probably goes numb. Don't overstretch because you're going to cause pain. And what I like to do is use gravity. So right here, don't throw out your back if you have a back problem or a fusion, but I press into my thighs, not painfully. I'm just kind of resting here to stretch my hamstrings, my calf muscles. But if you do this every day, you can track it. And I love to use a towel inside of my thighs as well. I'm stretching right there. But if you're having a hard time,
A device like this, an ankle slant board, can help you keep track of it. So it starts at 15 degrees and see, can you touch the floor there? I can right there. But now I move up to say 20 degrees. And what happens is for a week or two, I'll do that. And if I feel pretty good, I'll move up to now 30 degrees as an example. I think this goes up to like 45, 50 degrees. But over time, you can keep track of your flexibility, get your calf muscles, your hamstrings flexible. And that's the trick.
Compression socks. Compression socks make a good difference. They can take that swelling down, those varicose veins down. That can get the pressure down and make a big difference. All of this swelling will stretch the nerves, stretch the tissue, and that can lead to some pain in the foot and in the ankle. And this can exacerbate all those small nerve fibers. So a compression stocking, good socks, and a good brace can help with that. There's different types of compression socks. So there's the knee-high ones that are over the counter. There's knee-high ones prescribed by a podiatrist like myself. So they can be 20 millimeters of mercury, 30 millimeters of mercury, or 40 millimeters of mercury or more. These ones that you buy over the counter are more like 10 millimeters to 15 millimeters of mercury. But what I would recommend is start off with over-the-counter stuff. The doctor stuff is hard to get and it's so tight and so uncomfortable that you can barely move, and it might not necessarily be good for you unless your doctor specifically recommended it. So as always, I include some of my favorites, some of the best rated ones, but you don't have to get anything from me. These are not my products by any means.
So check out some of these compression socks right here. So you could see down here the different size. They actually do a good job showing you the different colors here, but specifically what you want to look at is they're not that expensive. Like 8 pairs for $17. Like, I mean, come on, that's like $2 per pair of socks. So it's like $1 per sock that you can keep re-wearing. So you can kind of see these are meant to be more athletic. There's some sizing guides, but these are marketed as nursing socks, but what I want you to look at is 15 to 20 millimeters of mercury. This is too low of compression for insurance to cover. Most adults that have swelling problems will not be able to get on the 20 to 30 or 40 millimeter compression socks. These are so tight that nobody wears them. In my experience, everybody tries to buy them, but maybe like 2% of people actually wear them. Get something that's low cost. So for like, a dollar per pair here, that's lower compression. If you find that it's not enough compression for you, then get something heavier. Don't goof around starting with like the 40 millimeter of mercury, trying to get insurance to cover it, because you're going to jump through a lot of hoops. You're going to waste a lot of time and it's going to cut into your skin and you're going to hate it. If you're like 98% of the patients I see, start with something low cost and lower compression, see how it works, see how it fits into your routine, and then go up to the higher compression. At the same time, take a look right here. The 20 to 30 millimeter of mercury are like $15. Why would you waste time driving to like different outlets, wasting gas, especially the price it is, trying to exchange prescriptions from your doctor to the medical supply company to get something like this when it's so cheap online? It just doesn't make a lot of sense to me. And realistically, you should go with the lower compression. This for the average person is probably a little bit too high and doesn't provide a ton of benefit. It'll cut into your skin and hurt you more than it will benefit you. So start with the lower compression rather than the high compression. Down in the show notes, I include my favorites. The recovery time on this can be 1, 2, 3 months, depending on which grade of tarsal tunnel injury you're on. Most people are like a grade 2 or 3 if they're watching a video like this. We're talking like 2-3 months potentially of doing all the right stuff. So the orthotics, the stretching, the ankle braces, this home slippers, all that kind of stuff, the icing and the massaging. It seems like it's not helping, but all of a sudden you might start getting better as 2 to 3 months go by. And that's the real trick. People do a lot of the right stuff, but they give up after a day because it didn't fix their problem. Be prepared. Know these nerve injuries can take a month or 2 or potentially more.
And weight loss. Get your metabolic disease under control. If you have diabetes, if you weigh 300 pounds or so, get healthy. I'm a huge fan of fasting. My favorite techniques and stuff are down below. I love to link them. I really hope that helped you, and I really wish your nerve pain gets better. If it doesn't, go see your podiatrist. Guys, thank you so much for watching this video. We appreciate your likes, your subscribes, your comment. We really love hearing if this stuff helps. It really makes a big difference for us, so thank you.
Difference for us. So if this video helped you at all, contribute down below. It really helps us out. Thanks, and we appreciate you.